Hi, Mrs. Smith. My name is Jennifer, and I am the nurse in charge here at the Children's Hospital. How is Mary feeling right now?
She is a little bit better, thanks for asking. However, I'm quite nervous because we've been waiting here for a long time now, and the doctor still hasn't seen her. I understand that emergencies happen, but it's been really difficult to keep calm when I don't know what's going on. Mary was feeling quite uncomfortable earlier, and I just want to make sure she gets the attention she needs as soon as possible. I know the staff here is doing their best, but as a mother, it's hard not to feel anxious when I see my child in distress and I'm left waiting without any clear updates.
I'm really sorry you and your daughter have to go through such a long wait here. I'd like to apologize on behalf of our hospital. The emergency department has been busier than usual today. As soon as the doctor becomes available, he will come over to see Mary. While we wait for the doctor, I need to take Mary's vital signs. Would that be all right with you?
Sure, nurse.
Thank you so much, Mrs. Smith. I truly understand how stressful this situation must be for you, especially when it involves your child's health. Right now, I want to assure you that Mary seems to be doing fine, and I'll be here to keep a close eye on her to ensure she stays comfortable and stable. I'll continue monitoring her closely so we can act quickly if anything changes. In the meantime, I'd like to ask you a few questions about Mary's condition, her recent activities, and any possible triggers that might help us better understand what could be going on. This information will be really helpful for the doctor when he arrives. Is that okay with you?
Certainly.
Great. Could you tell me what symptoms Mary was experiencing when you decided to bring her here?
Yes. She was suffering from chest tightness, wheezing, and dyspnea. She was struggling to catch her breath, and I could see how uncomfortable and frightened she felt. It's been quite alarming to watch her go through this, especially since she's never experienced anything like this before. I'm really anxious to talk to the doctor as soon as possible so we can understand what exactly is happening with Mary and get the right treatment started. I just want to make sure we're doing everything we can to help her feel better quickly and prevent this from happening again.
I understand, Mrs. Smith. Those symptoms can certainly be concerning. And how long has she been experiencing these symptoms?
They started about 2 days ago. Do you think she might have asthma?
It's understandable that you're worried, but I can't provide a diagnosis right now. Only the doctor can give you that information after a thorough medical assessment. However, I can reassure you that Mary is stable at the moment. Her vital signs are all within the normal range, and I'll continue monitoring her closely while we wait for the doctor. Do you have any family history of asthma or other respiratory issues that you know of?
Yes, actually. My husband had asthma as a child, but it's been under control for many years now.
Thank you for sharing that. Family history can sometimes play a role, so it's good to know. Have you noticed if anything in Mary's environment or routine has changed recently? Sometimes factors like allergens, weather changes, or exposure to smoke can trigger these symptoms.
Well, we recently adopted a cat. Mary loves the cat, but I'm not sure if that could be causing her symptoms. She's never had any allergies before.
That's good to know, Mrs. Smith. Sometimes new pets can introduce allergens that might cause respiratory issues in children. I'll make a note of that for the doctor. In the meantime, do you feel like Mary is having any difficulty breathing right now? Or has her condition improved since you arrived?
I think she seems a bit more relaxed now, but she still looks a bit uncomfortable.
That's helpful information. I'll keep monitoring her and make sure to pass all of this along to the doctor when he arrives. In the meantime, if Mary starts to feel worse or if you notice any changes, please let me know right away. It might also help if we try to keep her calm and comfortable while we wait.
I'll do my best. Thank you, nurse. I just hope the doctor comes soon.
I completely understand, Mrs. Smith. I will stay right here with you both and ensure Mary receives the care she needs. While we wait, could I offer you a glass of water or perhaps a blanket to keep Mary warm? Sometimes little things can make a big difference in situations like these.
A glass of water would be nice, thank you.
Of course, I'll get that for you right away. And remember, if there's anything else you need or any other concerns you have, just let me know. Your comfort and Mary's well-being are our top priorities.
Thank you, Jennifer. I appreciate your kindness.
You're very welcome, Mrs. Smith. I'll be back in a moment with the water, and then we can continue keeping a close watch on Mary together. We're here to help in any way we can.